Physical education classes like this one are fewer and far in between than they once were. Most schools are limiting PE to once a week. That, combined with poor food options in the cafeteria, is contributing to an obesity problem with our youth.
I have talked about the statistics. We have all heard about them, but they always bear repeating. How nearly 1 in 3 children in this country are overweight and obese. How 1 in 3 kids will suffer from diabetes at some point in their lifetime as a result. And how we're spending $150 billion a year to treat obesity-related conditions like heart disease and cancer.
The First Lady announced her Let's Move initiative 3 months ago to combat the problem, and this week unveiled an action plan to make it happen. Part of the plan is to reduce marketing of unhealthy products to children, improving health care services including BMI measurements for children, suggesting healthy foods in schools, and making sure kids are leading physically active lives.
We know the steps that we need to take to reverse the trend. Through Let's Move, we've already started making some progress. We've gotten wonderful support from all sectors of our country. And now with this report, we have a very solid roadmap that we need to make these goals real to solve this problem within our generation.
All right, first thing we're going to do is do jumping jacks. You ready? And go.
Lyle Price is a physical education specialist with the health department. He goes into schools and works with overweight students to help them reach their health goals. He says he can't measure the success of a student by the results. He knows there are contributing factors to obesity, such as their lifestyle at home, that counteract what he is doing.
It can be frustrating at times, but what I look at it, I look at success with a kid when I'm done with that child, like at the end of the year, and they're still having fun with the program, you know, and you saw them exercising, and they were all smiling. They were, had smiles on their face, so they were enjoying what they were doing. And another part of the success of the program is how the kids feel about themselves.
Price says it's going to take initiatives like Let's Move to get everyone involved in helping solve the obesity problem.
I think a lot of it has to do with there's not a connection between the groups that are trying to reduce childhood obesity. Like, we're trying to teach them how to eat better and be more physically active, but sometimes the schools, if you look at the school menu, for example, I walked through a breakfast line the other day and they had biscuits and gravy and hash browns.
Kit Hines with Sodexo says they have been working to improve the food choices in the Tulsa Public School District for their students.
We already were ahead of the new initiative that is coming out. We put unlimited fruits and vegetable bars in all our schools about 3 years ago. And what that does is gives the children an opportunity to come and get fruits and vegetables in unlimited amounts and add that to their meal.
And while they have made changes such as using more whole grains and replacing whole milk with low fat, she says all of the necessary improvements are not going to happen overnight. But until then, health officials will continue doing their part to encourage kids to make healthy choices.
1, 2, 3.
Go Bears!
1, 2, 3.
Go Bears!
Shake it up.
The goal of the national campaign is to return to a childhood obesity rate of just 5% by 2030, which was the rate in the 1970s before childhood obesity became a problem. In Tulsa, I'm Angela Rosecrans, the Oklahoma News Report.